Welcome back, everybody. Derrick Soo, your 2022 Oakland mayoral candidate. Today, I'm going to talk about being service resistant. Well, what is service resistant? Well, if you follow along with a lot of what Oakland says, they spend millions of dollars taking care of the homeless. And what they've been finding is that a lot of people don't want to go and accept the services that the city of Oakland provides. And they call us service resistant. And so I want to clarify what service resistant is, because there's two versions of this, fortunately. One is the city's version, and then the other version is that from the street, like myself. I was actually living here on Oakland streets for 5 years and 5 months. So I think I know a little bit about what's going on the streets. And the definition that we have is far different than what the city of Oakland's definition is. Here's what the city of Oakland's definition is: unwilling to accept social services from agencies. Period. That's Oakland's position. And then our position, the homeless definition, is that we're unwilling to be abused, lied to, having our personal property taken and destroyed. And then when something doesn't go right, or we don't agree what the city does with their programs, they'll evict people. They throw you out on the street. Or they'll just put you out on the street and won't let you in, because it's run like a jail, run like a prison. Literally, you got to buzz yourself in. You have to be cleared by one of the staff to come in. And so they can actually do a lockout on you. And when I stayed inside of EOCP here in Oakland, the Oakland Shelter, East Oakland Community Project, otherwise known as Crossroads, they actually lock people out. They refuse to let people back into the shelter, and if they didn't leave, they would call Oakland Police Department to have them removed from the property. So it's not that we're resistant to the service. We just don't like being abused and treated in a really undignified way. And then some of the other problems that I've seen is that city of Oakland unreasonably changes policies at whatever they feel like, and that could be on site while they're doing a camp clearing. They'll change policy. All of the shelters are run like prisons. You're told when, where, how, and when not to. Mostly when not to. So these are all things that are what we include in those of us that have been labeled service resistant. And the agencies that we really are resistant to are these city and county agencies. So most are contracted with the city of Oakland, and then some are contracted with Alameda County. Worst one of the bunch, Operation Dignity. They operate the Mandela Parkway community cabins, and they manage a majority of the community cabins here in Oakland of Libby shafts. So they're a problem to begin with, and my issues go all the way back to 2016 with Operation Dignity. And the founder and I have a very, very tumultuous relationship. Next one up is another horrible one, and that's BACS, Bay Area Community Services. They're another abuser. It's uncanny at how awful this operation is. Bay Area Community Services. They lie, and they have no proof or documentations on the numbers that they present. They've been in the news for abusing a lot of us homeless. They also operate several programs here for the city of Oakland. One of them being the Henry Robinson Center, downtown Oakland. And they call it a social rehab program. And it's a 90-day program, and supposedly at the end of the program, when you come out, you're going into permanent housing, or that they put you back in connection with your family members, and if you and your family members were able to work something out, then you may be able to go back living with them. And so the numbers that BACS creates and gives to the cities is a complete falsehood. We have that documented in on KPIX, and they did a whole series on. We have 2 videos that are not complimentary on BACS, and you can go back and look at those. Another organization is City Team downtown, and I don't get me started with them. But anyway, then we'll move on to East Oakland Community Project, EOCP, and that is a shelter, a full shelter there. When I was there, that was 135 bed shelter, and it was full. Another one that I'm currently fighting right now at the Safe RV Park, and that's Housing Consortium of the East Bay, another poorly run and managed operation. Then we have St. Vincent de Paul, and then finally Abode. I don't have anything negative to say about St. Vincent de Paul. I've done some things with that organization, and I have no issues with them. Abode, I do have some issues. I just won't go into them right here. So, common complaints by the homeless of all of the mentioned agencies. The common complaints here, I have made a note of them from those that I spoke to from the streets. Number 1, extensive list of rules for working with those or living in those agencies. Another very common issue that folks have is diseases, the transmission of diseases. The most common is foot fungus in the showers. Then there's another common thing, which lice, head lice are very common. Bed bugs is another very, very big issue in the shelters, and very common. Those are the 2 most common issues at any of the shelters. Then another common complaint, curfews, and then also no guests are allowed to visit. And so if you want to meet up and hang with your family or friends, they can't come visit you. And so that causes a lot of loneliness in the shelters, in the Safe RV Park, because that's been a big complaint that I've been fielding here for the past few days from this new Safe RV Park for the seniors, is the loneliness, because they're not allowed any guests. In fact, I just got reinstated on Friday. So Marichelle is aware that she can't deny my access now, and this comes from county to Marichal. So I'll be back working with my clients on site starting Monday, because I have some follow-ups to do over there, and they are aware that I'm coming. So that's a big, loneliness is a big problem for all the shelters. Then the other, number 4, verbal abuse and total lack of oversight of the staff and or management. Management is not accountable to anybody or anything on any of the above agencies. They don't have to provide documentation for anything. They don't have to provide numbers. I mean, it's uncanny to hand over that kind of money, millions and millions of dollars, to these agencies and not have something built in to show what they actually did with the money, where these people went, how it was spent. So there's no oversight whatsoever, and that leads to a tremendous amount of abuse, and we see that commonly throughout the country. It's not just here in Oakland and Alameda County, it's everywhere. And because of that, the homeless issue has become an industry into its own self. Another big one for the smokers, there's designated smoking times and certain areas, and if it's in the winter, it's a miserable out there for those folks. Then another issue that we run into commonly, there's no storage for personal property, or very limited storage. Then in most cases, when you go into a shelter, you're not allowed to have any drugs or medications in your room or on your person. And so all your prescribed medications are turned over to the staff and management. Well, it's been commonly known that medications disappear, especially those that are narcotics. And there's just no accountability on that staff. And everybody knows they're the only ones with the key. So it's very limited as to who had access to that cabinet, because only a certain amount of people, certain people had the key. And unfortunately, some of those people are the volunteers, and they're there volunteering. And so they obviously think that stealing some narcotics from homeless people is okay, because that's what happens. I've seen it, and it's ugly. It's really ugly. Or if they don't steal it, they just tell you, well, it's not here in the cabinet. I don't know where it went. And so they claim that it's misplaced. Another exciting thing that's on the complaint list is unannounced inspections. And that's very common in shelters, very common. And they're looking for contraband. But the funny part is, shelters are just full of contraband. They when you go into one of the Oakland shelters, you sign some documentation saying that you're not going to consume alcohol on the properties, you're not going to do drugs on the property. So not supposed to be any alcohol nor drugs inside the dorms. When I was there on the men's floor, we had one room where we called it Skid Row. Skid Row was the drug dorm. Everybody was on needles or pills. Then we had the brewery. Yeah, that one speaks for itself. So, and in each one of those rooms, there are 14 people in each one of those dorms. So that's a problem when you tell everybody no alcohol, no drugs, and then drugs and alcohol are very rampant. And then on top of that, staff, they favor certain people at times because they're more cooperative or they're snitches. Then there's complete lack of training or state certifications for any kind of social work training. None of them have any. Another common issue that I have is the constant violations of OSHA and health care safety standards. These places just totally disregard the healthcare safety standards in most cases. And another common feeling that everybody has in the shelter, nobody ever feels safe in the shelter. Most people will tell you, I feel safer on the street than in the shelter. So, what can I say? Anyway, when the new RV Safe Park, when it was being created, a number of us got together to create this to be significantly different from past Oakland programs. One of the biggest thing that we lobbied for first thing up was that the life span was going to be well beyond 1 year, because typically Oakland only does 1 year programs, and then as they close and fold up, then they move on. But that never solves the problem, because none of the folks that were in those community cabins end up getting any kind of housing, and they end up cycling right back out onto the street. And that was the norm. No matter what Libby is telling you, it is a factual lie. And I will tell that to her face too, because I've known a majority of the people that have been through these community cabins, and it's a joke. It's a horrible situation. In fact, I have a couple that were in the Mandela Parkways. This was a big City of Oakland cover-up on Mandela Parkway, what happened over there, and it was a travesty. I'm not going to go into it now, but there was a fire there that burned down the community cabins and a gang takeover. Yeah, there was a gang takeover of the Mandela Parkways, but I'll tell you about that a little bit later on. And that's a cover-up unto its own that Oakland really buried. Anyway, back to the RV Safe Park. My biggest complaint with the RV Safe Park is that we had to select from one of the agencies that were known already, and I didn't like any of them, especially Housing Consortium of the East Bay. They have a horrible track record of care. They're very prison-like operations. When they don't have answers, they stonewall you. And there's just a whole host of issues that I have with that agency. We had to go with one of them, and so they were selected. What makes the park different is that this is actually set up for a long-term project. We don't have, there are porta potties on there for the staff, but each of the trailers are hooked up to a sewer service on the property. They have fresh water that comes in. They have the shower heater, air conditioning, refrigerator, microwave oven. So it's a substantial upgrade from living on the street. Also included on there is Wi-Fi on the entire site. So folks with cell phones, iPads, or whatever, or even TVs with Wi-Fi capability can just tap into the Wi-Fi, watch TV, or get whatever information they want from the Wi-Fi. And it's all included. Also, with that, the park receives breakfast, lunch, and dinner for each resident there at the RV Safe Park. Then they don't have to do laundry, because all they have to do is bag it up and drop it off the evening before laundry pickup, and free laundry. So it's a great program for these folks, the ones that are seniors that have been living on the streets suffering, and this helps secure them a little bit better than where they were. But some of the problems that I've been dealing with recently, because if you've been following along with Oakland Safe RV Park, we had a big power outage a couple of weeks ago, and it nearly killed one of my Alameda Health Systems clients. And I put this all over the news. It was on Channel 5. So anyway, we have very strict rules of conduct for the residents. The residents have no say in these rules of conduct. And they're not being real tolerant yet of our self-governance model that we're trying to establish over there, which essentially is unionizing the residents against management. So Housing Consortium of the East Bay is the management. They tend to be very unfair. So what we're doing, we're organizing the entire camp of seniors. There's 134 occupants there, so they should definitely have a say in what goes on in their community. So that's one of the problems that we're having, but we're starting to negotiate that. Things have drastically changed as of Friday, so we're going to see what happens here in the coming week. But in the past, we've had meals not delivered or distributed properly. We had a uncaring staff when it came to health and safety concerns. Staff was very indifferent to medical emergencies. We had an epileptic seizure, and they were very slow to call 911 to get any medical attention. And so that was a big deal. Then we had a senior who fell off the stairs at trying to go in and out of their trailer, and it came down to a lack of safety rails, which I have been bringing up for a number of days to their attention, and they refused to hear it. And then this individual fell and fractured their arm, and it appears that they may be in a sling for up to 90 days. So that's a problem. And then we have another issue, inability to get approval for medical and social caseworkers to enter the site to meet with their clients. Like I said, earlier, I was actually banned. And then when they banned me, they had to ban everybody else. Social services caseworkers, medical caseworkers, rehab workers, they banned everybody. And to be allowed inside the fence, you had to go through this unreasonable approval process where that those individuals that needed to approve you or had to talk to you wouldn't even talk to you, wouldn't answer your emails, wouldn't call you back, and you couldn't ever reach them. So that's what goes on. And City, the CAO, and Libby don't want you to know that. And that's how they spend your tax dollars. Some other things, but like I said, last Friday I got reinstated, so things are going to change. Yeah, another complaint here. Staff and management lie and misrepresent what they're capable of doing. There's no official certification or documentation of social work training by any staff member, including management. So that's an issue right there too. Then they have unprofessional conversations between staff and upper management about the residents. That's not cool. Unlicensed, and it's an unlicensed healthcare facility. I brought that up last month, because they talk about this being a senior facility. So this is essentially assisted living and a healthcare facility. So that needs to be licensed and then inspected, because there are health and safety requirements, standard operating procedures that have to be adhered to so that our seniors aren't injured like they were in the past. And that's what I've been advocating for our seniors, because they don't want to hear it. Libby didn't want to hear it. CAO didn't want to hear it. And HCEB threw me off the site because I frustrated them so much. And since we have so many elderly folks with medical conditions, there should be somebody with medical training on site 24/7. That's highly recommended, especially for the seniors. And but there's nobody. There's nobody that I'm aware that even carries a CPR card on site. There's no CNA. There's no RNs. There's nobody on site to deal with mental crises. So there's definite need for medical personnel to be on site 24/7. In the past, my experience at East Oakland Community Project, Crossroads, the homeless shelter. I was at that shelter for 91 days, and in my final week at EOCP, we had a drug overdose in the dorm room overnight. Yeah, a 26-year-old brought in heroin, injected it into himself, into his arm, and he was found the next morning, needle still in arm, and he was hard as a rock. Freaked everybody out, but that's not uncommon. That's the sad part. And these shelters, these organizations don't want you to know about those things because it makes them look really bad, which they are really bad. Then on this new Safe RV Park program that I go out and I talk to a lot of seniors. I really try and encourage them to try out this program at the very least. Everybody's question that I get, well, who's overseeing it? And I have to tell them. And then when they find out, oh no, I don't want anything to do with them. No. And so I've actually had people walk away from the invitation during intake because they saw a person who had abused them from another agency that was on site. So I've had that experience. We have a lot of problems with the agencies that are the intervention agencies that are supposed to be helping the people, and the people don't want to go to these agencies because of the abuse, the problems, the lack of dignity. It's just a whole host of issues that these folks are inflicting on people. It's just so frustrating. And when you first walk into the shelters, you get a hostile environment feeling. There's no happiness. Everybody's angry. Everybody's mad or super sad. It's a bad situation. And Oakland refuses to hear it and deal with it. Agencies, these intervention agencies are behind it, and they don't care because they're getting money and they have no accountability. You know, in the past, I've interacted with every single CAO director of Libby Shaft. You know what I got? One director said I was picky about my situation and that I should be happy with the services that I was being provided with. If you knew what I was being provided with at the time, wouldn't have been good. But it was their way of just short of calling me service resistant to my face. So I ask you, are you getting the bang for your buck that you expected, knowing the truth? Am I service resistant, along with thousands of others here on Oakland streets? No. What we say is, fuck the system.